Welcome to our video on appendicitis, a common yet potentially serious condition affecting the digestive system. In this video, we'll explore what appendicitis is, its causes, symptoms, diagnosis, treatment, and more. Our goal is to provide you with a comprehensive understanding of this ailment. Let's start with the causes, or etiology, of appendicitis. The most common cause is a blockage in the lining of the appendix, which is a small, finger-shaped pouch that projects from your colon on the lower right side of your abdomen. This blockage can be due to a variety of factors, including fecalates, which are hardened stool, lymphoid follicle enlargement, tumors, or, rarely, parasitic infections. When the appendix becomes blocked, bacteria can multiply inside, leading to inflammation and infection. Now, let's delve into the pathophysiology of appendicitis. Once the appendix is blocked, the pressure within the organ begins to increase. This increased pressure can lead to the compression of blood vessels that supply the appendix, resulting in ischemia, or a lack of blood flow. The lack of blood flow damages the appendix wall, making it vulnerable to bacterial invasion. The inflammation and infection cause further swelling and pressure, potentially leading to perforation, where the appendix ruptures. This rupture can release infectious material into the abdominal cavity, leading to peritonitis, a serious and life-threatening infection of the abdominal lining. Appendicitis is a fairly common condition. It affects about 5% to 10% of the population at some point in their lives. While it can occur at any age, it is most common in adolescents and young adults, typically between the ages of 10 and 30. There are no specific risk factors that definitively predict who will get appendicitis, but a diet low in fiber may potentially increase the risk. Geographic location and socioeconomic status don't appear to be significant factors. The signs and symptoms of appendicitis can vary, but some are more typical than others. The classic presentation often begins with pain around the navel, which then migrates to the lower right abdomen. This pain tends to worsen over time and can be described as sharp and severe. Other common symptoms include loss of appetite, nausea, vomiting, constipation or diarrhea, abdominal swelling, and a low-grade fever. It's important to note that not everyone experiences these symptoms in the same way, and some individuals, particularly children or pregnant women, may present with atypical symptoms. Diagnosing appendicitis typically involves a combination of a physical examination, a review of your medical history, and diagnostic testing. During the physical exam, the doctor will check for tenderness in the lower right abdomen, specifically at a point called Burney's point. Blood tests are often performed to check for elevated white blood cell counts, which can indicate infection. Imaging studies, such as a CT scan or ultrasound, are also frequently used to visualize the appendix and identify any inflammation or blockage. A CT scan is generally more accurate, but an ultrasound may be preferred in children and pregnant women to avoid radiation exposure. Appendicitis doesn't typically have multiple distinct classifications or types based on the underlying cause. However, we can describe the progression or severity as uncomplicated or complicated appendicitis. Uncomplicated appendicitis refers to inflammation of the appendix without perforation. Complicated appendicitis means that the appendix has perforated or ruptured, leading to peritonitis or an abscess. The primary treatment for appendicitis is surgical removal of the appendix, a procedure called an appendectomy. This can be performed through an open incision or laparoscopically, using small incisions and a camera. Laparoscopic appendectomy generally results in less pain, a shorter hospital stay, and a faster recovery. In some cases of uncomplicated appendicitis, antibiotics alone may be used as a treatment option, but this approach is less common and requires close monitoring. If the appendix has ruptured and caused peritonitis, antibiotics are essential, and the abdominal cavity may need to be washed out during surgery to remove infectious material. Post-surgery pain management and monitoring for any signs of infection are crucial. Unfortunately, there is no guaranteed way to completely prevent appendicitis. However, some studies suggest that a diet high in fiber may help reduce the risk. Eating plenty of fruits, vegetables, and whole grains can promote healthy bowel movements and potentially reduce the likelihood of fecalates forming in the appendix. The prognosis for appendicitis is generally excellent, especially when it is diagnosed and treated promptly. With timely surgical intervention, most patients make a full recovery without any long-term complications. However, if the appendix ruptures before surgery, the risk of complications, such as peritonitis or abscess formation, increases. Recent research is exploring non-operative management of uncomplicated appendicitis using antibiotics alone. While this approach shows promise, it is still under investigation and not yet considered the standard of care. Additionally, researchers are continually working on improving diagnostic techniques to detect appendicitis earlier and with greater accuracy.